established the first research community in Egypt and the Middle East. Our team is composed out of young, talented Egyptian scientists and European experts. Together, we develop high-quality and cost-effective genetically engineered drugs.
MENA Pharm's Egyptian biotech subsidiary has enabled the introduction of a portfolio of complex genetically engineered medicines which compete with large pharma products. Its German subsidiary, Probiogen, is a global provider of intelligent proprietary technologies for the biotech industry at large.
There is substantial evidence that a new age is dawning for Egypt to offer exceptional opportunities, and MENA Pharm is perfectly positioned to ride into the future with life-saving and life-enhancing, innovative and yet affordable products.
Striking the balance between innovative and affordable medicines is the mantra at the company's core, allowing MENA Pharm to play an important social role by responding to the complex challenges of unmet medical needs of emerging countries. MENA Pharm's desire to overcome these challenges helps the dreams of the next generation to be fulfilled.
Bismillah ar-Rahman ar-Rahim. Good evening, good morning, and good afternoon to everyone. I would like to thank very much MENA Pharm for the very kind invitation to present something which is very near to my heart, that I like very much, which is artificial intelligence and vascular disease. I hope within the next 30 minutes we'll have the lecture, and I'm very eager to have an interactive discussion. So if you have any question, please put it on the chat, and I will be delighted to answer the question. And you can use the raise your hand. So artificial intelligence and Exolaser for varicose vein. Actually, artificial intelligence have changed everything we know. Now, even in the war between Russia and Ukraine, artificial intelligence is playing a big role. Now there is drone attack. You have seen yesterday drone attacks 300 kilometers inside Russia. It wouldn't have been done without artificial intelligence. And now to control the internet from the sky is becoming very important. It also have changed the computer technology. Now there is a new computer with Copilot and BC. Even the BC technology is changing. Even Apple Mac computer has changed. So it is also affecting our vascular surgery. And let us take one of the easy topics, which is Exolaser for varicose vein. The learning objective, because we don't learn by accident, we learn by intended learning objectives. And the number one is importance of AI in vascular surgery, which is very important, and demonstrate the steps of management of laser telangiectasia, advantage and disadvantage of different techniques, summary of one center experience, which I did work in for around 30 years, and I collected at the end 10 tips and tricks in using laser and my conclusion. So this is learning objective. Number one, someone will say, what is the relation between artificial intelligence and Exolaser? I will tell you the first example. The presentation that I made to you today is made by Copilot. Now, Copilot is an artificial intelligence by Microsoft, which already you have the data in OneDrive. So I've told the Copilot, he will not create a presentation. At the moment, it's forbidden. But what you can do is to ask him to give a visual basic code, what is called VBA code of a presentation. So I've asked Copilot, because he has all my presentation, he has all my books, he has all my patient in his background. And I've told him, can you create a VBA code of laser presentation using my files and my data sheet? And that is why the answer came with the following presentation. So it's very easy. If you go to present a topic by tomorrow, you can just go to Copilot and ask a Copilot to prepare presentation for you, and it will happen right away. Definition of laser and telangiectasia. Laser mean light amplification by the simulated emission of radiation. This is the short name for laser. It's been well known over the last 30 years, and we actually use it a lot for telangiectasia. Telangiectasia, by definition, is intradermal dilatation of superficial papillary venous plexus of vein that can be immediately under the vein, can be a little bit deeper, and we will see when we select the laser technology which is the best for them. So this is definition of laser. Nowadays, artificial intelligence is in the virtual reality. So in the old days, we used to take history and then do examination. You just see vein of your vision, but this is not sufficient. Even when you do duplex scan and you find patient to have reflux in different areas, you must have augmented reality. And I will show you the video of augmented reality. And you also have vein light. So you must examine the area by augmented reality and vein light, not just by seeing vein and then you decide the treatment. This doesn't work. So I hope the video will work. Here is the video for the augmented reality. You can see this is a picture by your eye, but if you put the green light of augmented reality, you can empty the vein, you can see the vein, you can see the feeder, which is feeding which vein, and how to control it. This we didn't see before, and it all depends about artificial intelligence. In the lower is also very easy equipment to call vein light, which will show you the vein in the subcutaneous tissue, and there is different ways of seeing it, either by red or blue light according to the depth of the vein. So this is the vein light, and this is how you start the injection. It's essential to do photo documentation to any case. And this is a problem in the Middle East because you must use DSLR camera, which is, let us say it's a high definition camera to give you accurate measurement. You must have a cloud storage. Every picture of the patient should be stored. You must control the focal distance, must be fixed when you see the patient, see progressive treatment. And external flash must be fixed. You don't rely on different lights. And I have added this in Egypt and all the area of Middle East, Saudi Arabia, ask the patient, because they are mostly female patient, to take the image. If you take the image themselves, then you are running into a lot of difficulties. So you can tell the patient not to buy DSLR camera, but to get the best mobile, standardize, get a picture before we start the treatment, and let us, you as a patient, have another picture after 1 minute. And this is, I think, is important. And the software I use is Adobe Lightroom software, which can analyze the picture. And I will show you statistically what does it mean to have the picture. Now, here we have a poll question to see some of the basic information of the attendee, and everyone is welcome. So the poll question 1, here it is. I will say the question and say the answer, and we'll see your replies. Which of the following is a key advantage of Exolaser technology? We have 4 options. High energy efficiency, compact and portable design, precise control of beam characteristic, or all of the above. So I can see the people who have done laser will take maybe 15 seconds to have this poll and then see the results. The more you know about the laser technology, how to adjust it, the spot size and the accuracy. Okay. That's fine. So end of poll. Here is the result. The result mentions that most of you got the correct result, which is all of the above. It was about 58% is the correct answer, because Laser have high energy, it's compact, and it's precise to the 1 millimeter. So this is the first poll question. Let us go back to the lecture. This is the correct answer. Now, artificial intelligence can generate images. So I've told another artificial intelligence platform, can you draw an image of a surgeon surprised to see a treating varicose vein? And here is the answer. You get an image straight away. And if you don't like it, you can change the color, change the white coat, but you can see the image is pretty good. It actually replied whatever. So during the presentation, the artificial intelligence can generate images. And this is important in vascular surgery. Can you speak to artificial intelligence? Yes, you can. And you can speak through your phone. So actually, it is so simple. I think the human nation have never had this amount of technology before. Never it has been so simple to get the information beyond the belief. In the old days, maybe 1,000 years ago, you need to travel from Saudi Arabia to go to Spain to learn a sentence from Quran. Just a sentence. You travel the whole distance. Now here, I can have artificial intelligence collect all the medical knowledge over the past 60 years in one basket. And I can put a question, and through an array system, I get the best answer. So let us hear. Let us think of AI as an experienced vascular surgeon, okay? As if he is your colleague. You ask your friend. So I put this question to artificial intelligence. What is the best treatment do you recommend for a patient with telangiectasia with saphenofemoral reflux? What is the best laser? And what is the joule power? And what is the spot size? And how do you do the follow-up? Use reliable sources. I just put at the end, use reliable sources in order only to get reliable sources from reliable library, which have a peer-reviewed journals. Okay, so I put this question exactly as it is to artificial intelligence. And here is the answer. Based on the medical condition you describe, he recommend pulsed dye laser. Okay, so here you have a colleague which give you an advice to the patient. And start not only this, but to explain why he selected pulsed dye laser. And this is the laser parameter. So you can see the laser parameter started wavelengths, 500 and 595, fluence, 6 to 10, spot size, 5 to 10 millimeter. He described to you the procedure. And he will tell you the follow-up. You need to see the patient 4 to 6 weeks to judge the treatment, which is absolutely right. And he mentioned to you the reliable sources. He took this information from the American Academy of Dermatology. And this is the answer. It's fantastic. In the old days, we used to go to another hospital, ask another consultant and see, wait for his answer if he's not busy. Now you can get it through your phone. How much should I charge the patient? Can you even ask this question? You can. How much money should I take from this patient? And here is the answer. It will tell you if this patient, if you're working in United States, but I've told him I work in Egypt. So I've told him how much it charges this patient in USA and in Egypt. He told me if you're doing this case in USA, take from 800 to 1,500 US dollars. If you're doing it in Egypt, take 150 to 400 US dollars. So he even give you estimate. But not only that, he's very clever. It depends on the location. لو انت العيادة بتاعتك في التجمع او whatever, it will make a difference. And your qualification, your reputation as a dermatologist or vascular surgeon, availability of laser technology, which machine you are using. And in the recent artificial intelligence, there is multiple machine, what is called Claude and Dal and Gemini. He will compare the answer. If you get the same question to this answer, he will get you an average answer as well. So the artificial intelligence can tell you how much to charge the patient. Let us go back to imaging. Imaging is extremely important. Why? If you don't tell the patient how is your varicose vein looks like before treatment, here the dotted line, if you don't tell the patient how much she improved, or you don't show her the images, this is how much improvement she think it is, okay? Hasn't improved much. But if you keep insisting on have an image every week, you can see this chart, it will, with the same patient, with the same result, just it have seen the image, she knows that she is a lot better, because patient improve slowly with laser, and they usually forget how the vein looks like before they started treatment. And that is why imaging is extremely important. I can't see any questions in the chat. I hope you're following up, but please, if you have any question, you can put it in the chat box and I can pick it up and see it right away. Useful classification. I use a very simple classification. Varicose vein, if you have varicose vein incompetence, I call it 1, 2, and 3. And if you have telangiectasia, I call it 1, 2, 3. And I made this schedule for me very easy in the clinic to have this kind of question. Now, this is a hospital in Cairo called the Magd al-Islam Hospital. And I have created the laser unit in this place. And it's a very simple hospital in Egypt, Shobra. And I was able to convince the CEO to buy 5 laser machines. Each laser machine is about $500,000. This is the first laser, it got CO2, carbon dioxide, and Nd:YAG laser, this is the probe, and this is KTP laser, this is the probe, and this is the diode laser, and finally, argon laser. This is a very simple hospital, not a big hospital, anything, and I took priority in buying different laser, and we started to get the laser unit to be bigger and bigger. And I got the 5 machine, and this is the room that I used to give laser. It's not a large room or anything, but you can be very successful. So my advice to vascular surgeon is start your laser telangiectasia unit, and it's very profitable and very useful as well. And penetration of laser. This is an important to know a little bit of physics about laser. Laser beam, according to different wavelengths, have different names. Not only this, but have different penetration power. Why this is important? Because some of the telangiectasia are in the immediate subcutaneous layer, some in the deep layer. So, for example, let me take this Nd:YAG. Nd:YAG, that's why it's a very common in vascular lesion. Okay, if you have any question, you can raise your hand. You can see bottom of the screen, raise your hand, you can click on it, and then we will be able to unmute you, and you can say your question yourself with your voice. This is Nd:YAG. You can see it take all superficial and deep. This is the diode laser, 512, and this is the different this is CO2 laser. You can see it's only used by dermatologists because it's just towards the skin, can be very helpful for the face, and KTP laser, and this is the penetration. So this is very important to know the physics of the laser waveforms that you are using. Now, theoretical advantage of laser over sclerotherapy. We all know sclerotherapy, very commonly used. A problem with laser really is to buy the machine, because the machine is a bit expensive. Number one, no extravasation RBCs. People are usually afraid of needle, called the needle phobia. Then you don't have any problem with that. There is no induced pigmentation, as seen in some cases of sclerotherapy. There is no allergy at all, because you not penetrate the skin. It's a positive effect of skin rejuvenation. And this is very important because it's used by plastic surgeon. And this is the only tool that can be used for lipodermatosclerosis. It can suppress inflammation also, which is very important. It have an anti-inflammatory effect, not like sclerotherapy. And these are the type of lasers that is used in vascular lesion. I will try to speak about little bit about venotonics. Venotonics is very important to select a very good venotonic for your patient. One of my preferred one is Doxium, calcium doxylate. I've used it for many years. It's not just safe, not just had FDA approval, not just very well known and abundant, but also it has an anti-inflammatory effect. That is why it is used a lot in diabetic retinal background retinopathy. It's used in telangiectasia. It's used in hemorrhoids, pre-operative, post-operative. It's one of the very, very essential drugs to be used if you are a varicose vein. And it is very trustable, and it has multiple advantages over others. This is also a pulsed dye laser, again, which has been recommended by the artificial intelligence. We can go to the second poll question. So the second poll question, you will see it on front of your screen, and you can select. So the question is, I will say the question, what type of exolaser is best suited for treating varicose vein? I did mention that quickly with the slide. Oh, I can see very correct, rapid answer. Here it is, very good. Number one, CO2, Nd:YAG, argon, or excimer exolaser. If you remember the slide, you will probably know which one. We'll give it another 10 seconds, and then we'll end the poll. This is a poll question. I can see all of you are experienced venologists or vascular surgeon with vein treatment skills. That's very good. Okay, we'll end now. And the 60% got it right, which is Nd:YAG. Nd:YAG laser is the best suited for vascular lesion. Is correct, and this is the explanation of it as well. Now, let us go back to vascular surgery. If you're reading about topic, let us ask the artificial intelligence this question: which is the best book to read in vascular laser? And I did put this question to artificial intelligence, and here is the answer. This is the best book, and it mentioned the book, focused on vascular lesion. It's comprehensive. It has a practical guide. It has been regularly updated. The book is part of the Laser Dermatology and Medicine, and overall Laser Dermatology and Medicine is the recommended book by artificial intelligence. And you can compare, you see, this is another 3 AI tool that I compare what is their answer will be. So artificial intelligence, if you are using it, it will guide you through a lot. It will tell you what to do to the patient, what to expect, how much to charge, what book if you want to read as well. So you can see all this is artificial intelligence, and it does not apply only for vascular surgeon, but also apply for medicine as a whole. Let us see that you got the book, okay? You can actually chat with the book. Looks very strange, isn't it? So if you have a paper and maybe the author has been died, okay? There's no author, not a living author anyway. You can put the document into chat doc. A chat doc will take the lead of an author, and you can ask question. What is the evidence of your paper? What is the advantage of your paper? Can you summarize your paper? And you can speak to him. This have never happened in medicine before. This is an open book that can speak to you. And if you go to www.chatdoc.com, this is the website that you can chat, and I use it every day. Every day. Let us summarize to go quickly. I think now 25 minutes gone, so I will go quickly with my 10 tips in order to open the floor for discussion. I can't see anyone who raised his hand, so I hope that the talk looks to be quite clear. But I'm sure there will be a lot of questions about even artificial intelligence. This is my 10 tips. Number one, each type of laser like a new car. So when you buy a machine, drive slowly, learn about it. This is the diode lasers that I bought about, I think 15 years ago. You need to read it thoroughly, start to implement it. Always start by testing area. So whenever you start a laser, don't tell the patient, I will do the laser of your right leg the whole today. Mistake. Start by testing area. Tell her, I will test area 5 centimeter by 5 centimeter. Select area which is not obvious. Select the least effective parameter. Start testing area and review the patient after 1 week. After that, then you can say, this is the result. We can apply it to anywhere else if you have the same parameters. So I selected this area, front of the chin, have 5 area. This is how it looks before. This is how it looks after. Are you happy with this result? Okay, let us do the rest. But if your parameters are wrong, don't destroy the whole leg veins by causing burns, for example. Now try cooling or local anesthesia. What I use is just to put cold water in gloves, different color, just a different color to make it just looks nice. And you have to use IMLA cream as well to lower the pain before you start your laser session. Number 4, laser can be used in the presence of venous reflux type 1. I thought if you have venous reflux, you need to treat it before treating telangiectasia. It's not true. You can treat telangiectasia even if you have venous reflux. These are the vessel diameter, and here is the result of a quick paper that I have made. And you can see that even if you have reflux grade 2, you still get benefit from telangiectasia. The smaller the vein, the better the result. The larger the vein, the worse is the result. But you can use it for lipodermatosclerosis because laser do skin rejuvenation. And this is important. Number 5, the best widely used vascular laser, you can see this is the 3 machine. All of them depend on ADIAC, KTP, or sometimes something called dual head laser, which means lasers that have dual wavelengths give you like NDIAC and KTP. So you can use both of them. And this is the advantage of a good machine. Useful tool of lipodermatosclerosis. This is the patient before. This is the patient after. This is the only tool that can be used in lipodermatosclerosis around venous ulcer or without venous ulcer. And this is useful tool. Number 7, best time of your result is 3 months. So don't tell the patient that you will see good results the next day. No, you will see good result after 3 months. So please keep holding on your expectation. And this is the last of the poll question, which is a simple question. I did mention the lecture. What is the typical interval required to see the best result from Exolaser? Is it 1 to 2 weeks, 4 to 6 weeks, 3 to 6 months, or 6 to 12 months? I can see you're putting your replies. We'll give it another 5 seconds. Okay. This is an important question because if you want to do laser, you want to know, tell the patient when to expect good result. Okay, we can see that most of you got the correct answer, which is 3 to 6 months, and which is the one before that is no big difference. I will accept it as correct as well. Okay, now augmented reality is becoming routine. So when you see a patient, this is a patient that you see without augmented reality, probably wouldn't observe much. And this is when you see with augmented reality. And this is after you've done laser. Maybe the visual is not that dramatic, but augmented reality is definitely much better. And always, this is a very important advice, lower the patient expectation. The more realistic you give to the patient, the better your outcome. Because the patient always want their lower limb to be like this. This is what they like it to be. And let us say we think we'll have an improvement of 80%, 90%. We can repeat it session, but nothing is 100%. Nothing is perfect. So always lower the patient expectation. Number 10, this patient is definitely not for laser. Oh, we got a question. What is your recommendation for a laser device which is affordable price to start with? That's a very good question. And I wouldn't say a company. I wouldn't say a specific name of a company, but there is, if you go to Google and say mini laser machine, which is a portable laser machine, which is about that size. This is a portable machine which work with battery. It is around, in Egyptian pound, around 100,000. And you can purchase it over 1 year, hoping that by working over for 1 year, you can repay part of it. Laser machine can go up to 25 million. But if you want a small hospital, you want to have Endolaser, Exolaser, both of them. You must have it portable, you must have machine, and it's European, so it has a CE mark, it have FDA, and this is what the machine that I advise you to go. But I wouldn't say the name of the company because, but if you go to search, Google search, and you put this requirement or artificial intelligence, it will give you name of 4 or 5 companies. And all of them have agent in Egypt, so it is not difficult. Secondly, you can go and visit a laser unit. I know a lot of laser unit both here and in Alexandria, and you can go and visit, can I have a look at your laser machine? What do you think? Is it all right? Shall I speak to the office, scientific office of this laser machine? So this is a very good question. I encourage you to start, Dr. Mina, and this is my answer to get the best machine. Okay, so back to the lecture, and we are, I think, about 32 minutes, so it's not too bad. And now is really a big drastic change. You probably wouldn't know this because I used to be a computer programmer when I was in medical school, and I've made a program to do diagnosis in medicine. And I got it published as well. And I used to machine code. So whenever you start writing codes, you use a website called GitHub. And if you search my name, GitHub, you will see some of the softwares that I made. Now, there is a software that being developed at the moment that will kill dermatology. That's it. Dermatologists will, maybe dermatologists wouldn't like me when I say that. But this is real application, and please look for this application. It's called Skin GBT. This is basically, it takes a photo of a skin, 5 by 5 centimeter. It gives you diagnosis, treatment, protocol, everything. It will be more accurate than the best dermatologist. We got another question. Fantastic. So the second question, is there other disadvantage of laser other than being expensive? That's a good question. Yes, there is other disadvantage other than expensive. It can be painful. It can cause hyperpigmentation as a response. It can cause hypopigmentation as a response. And the worst one is burn. If you remember, when you do endovenous laser ablation, we inject tumescent anesthesia to make the laser fiber away from the skin to avoid burning the skin. But now there is a machine which could never burn the skin. It's called dechargeable laser, which laser could never burn the skin. So yes, there are complications with laser other than being expensive, but it is the standard, it is the highest, it is number one. If you have a varicose vein and you go to a clinic in United Kingdom and the patient offer you great saphenous vein stripping and the multiple avulsion, you probably will be sued, because the best treatment, the least expensive, is endovenous laser ablation, or EVLT. This is number one. So can artificial intelligence kill a specialty? Yes. And this is my opinion. It actually started to kill diagnostic radiology. If your job is to diagnose CT scan, you will be out in 5 years. Now we know artificial intelligence can diagnose CT scan more accurate than the best three consultant intervention radiology because it look at the pixel. It doesn't look at the whole image. It look pixel per pixel. It diagnosed the cancer breast better than human. So if you are diagnostic radiology, your job is in danger. Skin GPT is the enemy of dermatology. And I'm trying to develop vascular GPT, which will read the angiogram, recommend the treatment, but I'm a friend of the vascular surgeon, so probably will not affect your career anyway. So go and search for skin GPT. Is there another question? Yes. Those lasers treat all cases? Does laser treat all cases of varicose vein in cases of laser fail to treat? Yes. It can treat up to, let us say, 3 millimeter. Some machine will tell you we can treat up to 4 millimeter, but I wouldn't be that strong in this view. But up to 3 millimeter diameter by duplex scan, you can treat with Exolaser. With Endolaser, you can treat up to 12. Now, after that, there is a technique called LaFosse, which is laser and the cryotechnology into the vein, and you can treat up to 20 millimeter great saphenous vein with LaFosse technique. But laser as such can treat up to 12 millimeter diameter. That's a good question. So, yes, another question. That's very good. Does you use Doxium after laser? I actually use Doxium before and after laser. And this is a very good question from Dr. Mohammed Zaki. I congratulate you for this question. And it gives you a little bit of pre-laser improvement. Then I do the laser, then for another 3 months, always on Doxium full dose. Yes, I do. And I'm very happy that I'm doing that as well because it did show remarkable effect with my patient. So search skin GPT. It's worrying. It's really worrying. Anyway, let us go to, can I send images to AI to suggest a treatment? This is beauty. So if you have a patient in your clinic, you take a picture of the varicose vein and you send it to AI and you get a reply, not a reply from consultant from United States, not a consultant in United Kingdom, but the best consultant because he has all the knowledge of medicine for the last 60 years. Let me show you what I have done. So I opened the clinic and I told the artificial intelligence, can I upload an image of telangiectasia to you to suggest the best treatment of this patient? So he said, hello, I'm very happy. Please send the image. I've uploaded the image and here is a reply. Based on the image, based on the image provided, the skin condition appear typical telangiectasia, and he recommended the treatment, and this is the follow-up. And he recommended laser, by the way, not sclerotherapy. And it is important, and this is because I'm involved with a little bit of artificial intelligence. The problem when AI happened in the beginning, that it was a huge data. It was not controlled. So if you tell artificial intelligence, can you show me how to make bomb, an explosion? It can get you the answer. And here started everyone to worry. We started to cut it, okay? Now, we started to see AI giving medical advice, surgical advice. And they didn't cut it, but they said, whenever you are giving an advice to patient or doctor, add this paragraph, which is this paragraph that you see. It's important to consult with a dermatologist to determine the most appropriate treatment. But in actual fact, AI is better than a lot of dermatologists. But this is just a protection that they have made artificial intelligence in order to cut its sharp edges. So, yes, and we got another question. That's very good. Does compression need an Exolaser and protocol to that? That's an excellent question. Professor Mustafa Berri. Professor Mustafa Berri, the one I know is a professor from Ain Shams University, one of the most important professors, if the name is correct, and he always asks me the difficult questions. So, to Professor Mustafa, does compression need to be in Exolaser? It's a debatable point. Some doesn't give compression at all. I used to give compression for 1 week after I do a session, not continuously, but I think it is helpful because when you affect the laser, the intima got affected. And when the intima is compressed and you got a little bit of compression, it can actually heal together better. But this is by no way a grade A recommendation or grade A advice. But I am the one which use compression. And secondly, what is the protocol? Protocol, I give it for 1 week after each session, either intermittent compression or compression the whole day. Some people say I'm comfortable with it. They can take it even and sleep with it as well. I use grade 2 recommendation, grade 2 compression. Okay, let us have the other question. What is the role of Doximum to improve this case? Yes. Let us say Doxium give you symptomatic improvement, but many cases are cosmetically. So even for cosmetic complaint, still it gives an advantage. So Doxium can decrease the edema, lower the pain if there is any pain, improve the walking, make it at the end of the day less painful, less swelling. But not only that, but if you notice cosmetically, it is even, you will get probably 20 to 30% improvement. This does not mean that it will cancel laser, but it is an augmented tool with laser. And if you give it you give the session, and you continue for 3 months, this is, in my experience, is the best scenario that I use with Doxium and the laser. And this is, you can send the image to artificial intelligence to recommend the treatment. So it's as if you have the whole medicine giving you the answer right away. You know that this answer took 5 seconds. 5 seconds. And you got the full detailed answer with its references. So it's really amazing how artificial intelligence is going to affect our practice. So, okay, I will go to the conclusion. Conclusion very quickly for the last 30 seconds. Conclusion, it will be vascular surgery. AI will change vascular surgery as we know it in the decade to come. And AI, I use it every day. AI is not going to take your job, but doctor who's using AI every day will take your job. AI is not going to take, no one is going to take your job, but anyway, I'm joking. AI is not going to take your job, right? Transdermal laser is very powerful weapon. Vascular region have FDA approval from 1999. And finally, a very precious gift from Minafar to the great 53 attendee in the meeting. I hope all of one will be a winner, but it can't be. So let us say the regulation of this prize, and it's a very valuable prize, believe me. Number 1, you need to submit your answer in the chat box in Zoom, live. Number 2, make sure that everyone can see it. So don't send the answer to just single one. Send it to everyone, so we should see it. I will give 3 questions. Each question have 1 correct answer, only 1 correct answer. Write the correct answer of the 3 questions. So please have a pen and paper beside you now. Let us say the answer first question is C, second question C, third question C, then the final answer will be C, C, C. Okay? Or as in the example here, A, A, C. So write the answer, and the prize goes to the first 3 correct answers. It's a very fair system. It is artificial intelligence system. We don't do anything to the selection, and it is obvious to everyone. Okay? Are you ready? So it will take maybe 5 minutes. Okay. First question, get your paper, get your pen, get ready. First question. What is the primary mechanism of action for Exolaser? Is it thermal ablation, photochemical, acoustic wave generation, or plasma formation? Write your answer. I will give you 10 seconds because you don't need to think about it. If you know it, you know it. So, and write it down. Okay. That's enough time? Okay. Told me enough time. Wait a little bit, wait a little bit. Okay. Okay, very good. Second question. Okay. Which wavelength range is typically used for Exolaser? Which wavelength? Infrared, 800 to 1600, visible, 400, 700, ultraviolet, or all of the above? Which wavelength? This is a difficult question, not an easy. Which wavelength range is typically used for Exolaser? How much nanometer? Write your question. You wouldn't have the chance of going into Google, putting the question, get the answer. We're more clever. We cut down the connection before you reach Google. Even if you use OCR and have, yes, okay. So you need to write the 3 question, not to write it now. Some people have write it now, but not now. We wait until they have 3 questions. This is second question, okay? Now we'll go to the third question. Third question, which is the final question. So you have 2 letters in your paper now. The third letter, which of the following is common application of Exolaser technology? Hair removal, tattoo, treatment varicose lesion, or all of the above? So this is the third letter. Okay. Okay, so put your answer. We're not going to tell you now what is correct until you make all, and everyone have 1 chance. So don't make A, and then after a bit B. No, you have 1 chance. And it's obvious to all of us. I think it's a very fair system. And let us give you maybe 60 seconds. Okay, because you shouldn't have time, because now you are just transmitting what is on the paper. You put it down. Okay, and we will tell you the correct answer, and we select. ما فيش لا كوسة ولا حاجة أهو عشان تبقى إيه ضامنين. I will. Okay. Yeah, we'll wait a little bit. Okay. We're waiting. Okay. So we should have around 60 answer for the 60 attendee. And this is 61 to select 3 places. Okay. I think everyone have put his effort. Very good. How much you got? You got something like maybe 20 have answered. Okay, that's not bad. Maybe next time we'll be more ready to take the prize. I was told it's a very valuable prize, but I don't know what it is. Okay, let us see the correct answer, which is in presentation. And let us start from here. Yes, that's it. Okay. So we'll see the correct 3 letters of the answer to the 3 questions. You like me to? Oh, you will write it down? Okay. Okay. Answer the question with them. You mean to go back to the 3 question again? Okay. Have you got the correct answer? It's okay. It's okay. No problem. We got the correct answer. We'll go back. It's okay. It's okay. The correct answer is 3 letters, and I can explain it. Just everyone is eager on suspense. They forgot the question now. They just concentrate on. Okay, it is ADD. So the correct answer is ADD. We'll go back And everyone can see the chat. Okay, we'll go back. BDD, you just, the very question is wrong. Gosh, triple A, wow. No, no. Yeah, still the first one is wrong. Come on, can't believe no one. ADD, yes, that's it, that's it. First one is Dr. Marcos Adib. Excellent, congratulations. Congratulations. Another one? Yes, another one. Doctor, he's a professor. He's a professor. Okay, or maybe he will be a professor. Okay, so we got two correct answers. Okay, you can check with the chat box because you all have a copy of the chat box. All can go through. The correct answer is ADD, and there are two candidates have got the correct answer. Congratulations, and let us. They want to be sure their name. Mustafa Biheri. Mustafa Biheri, correct. And we will contact you. And Dr. Marcos Adib. Marcos Adib. Excellent, congratulations, well done. Sorry I took a long of your time. We're now about 50 minutes. And I wish you all the best. I hope you enjoyed my lecture. It wasn't that boring. And I hope you enjoy the prize too. All the best.